Hi all, welcome to Eduwizz Academy. Myself Meera, faculty of Eduwizz Academy, Pharmacy. So today we are going to discuss about small demo session about the respiratory system. Okay, so respiratory system consists of nasal cavity, nostril, soft palate. So this is a common picture including the respiratory system, right? So we need to discuss about drugs. So we are focusing here about drugs used for cough and drugs used for bronchial asthma. So this is the KD Tripathi classification for cough classification. So pharyngeal demulcents are there, expectorants are there, antitussives are there, and adjuvant antitussives are there. So pharyngeal demulcent means lozenges, syrup, glycerin and licorice. And in the case of expectorants, which are mucokinetic, okay, which expel our sputum from the lungs. So that is secretion enhancers and mucolytics are there. Secretion enhancers are potassium citrate, potassium iodide, guaifenesin, tolu balsam, basaka and ammonium chloride. And mucolytics, so mucus is lysis. Lysis means break down the mucus. Okay, so that is bromhexine, ambroxol, acetylcysteine, carbocysteine. And in antitussives, that is cough center suppressant, which suppresses the cough centers and decrease the cough production. So they are classified into opioids, non-opioids, antihistaminics, pulmonary receptor desensitizer. And opioids are codeine, ethyl morphine, falcodeine. When you notice some cough syrup for small children, which are indicated for small children, in that cough syrup label, you can see this medications. Okay, that is codeine, ethyl morphine, falcodeine, and all. And non-opioids are noscapine, dextromethorphan, and clofenidiol. And antihistaminics are chlorpheniramine, diphenhydramine, and promethazine. And pulmonary receptor desensitizer, which decrease the pulmonary receptor sensitization. So the cough will be decreasing. So that is pre-nox-dioxin. And adjuvant antitussives are bronchodilators, that is salbutamol and terbutamol. Our bronchi being constricted due to cough, so we need to dilate the bronchioles, right? So we need to dilate the bronchioles, so we are giving with bronchodilators like salbutamol and terbutaline. You can see the salbutamol in asthma patients, we are giving with inhalers and all. You can see this content. Okay, and drugs which are used for bronchial asthma are bronchodilators, as we discussed in the cough itself. It is divided into three portions, that is beta 2 sympathomimetics, methylxanthines, anticholinergics. So decreases the acetylcholine level and decrease all the secretion. That is the mechanism behind the anticholinergic drugs. And beta 2 sympathomimetics, beta 2 receptor is present in the lungs and bronchioles, so it decreases the beta 2 sympathomimetic. It acts like beta sympathomimetic drugs. Okay, so methylxanthines, and these three classification are bronchodilators and leukotriene antagonists. You all know that when the mast cell stabilization is being done, so the leukotriene will release. The leukotriene is responsible for the asthma, sneezing, wheezing and all, right? So that is montelukast and saffrolukast. And mast cell stabilize. We need to stabilize the mast cell, which is responsible for the leukotriene, interleukin and all the products. So sodium chromoglycolate and ketodiphen. And corticosteroids are systemic and inhalation are there. Systemic therapy we are given in the form of IV, that is hydrocortisone, prednisolone and other glucocorticoids. And inhalational therapy are beclomethasone, dipropionate, budesonide, fluticasone, propionide, and flunisolide and cyclisonide. Okay. And last one is anti-IgE antibody, that is omalizumab. And so we are going to discuss about in detail about the drugs which are used for the cough. So first one is pharyngeal demulcent, that is soothing agent. So it will soothe our throat or soften our throat. So they are lozenges, Example are strepsils. You all know that in the community pharmacy, whenever we are facing with a sore throat, we will rush to buy the strepsils, right? So second one is glycyrrhiza, third one is glycerin, propylene glycol, and honey are the common pharyngeal demulcent or soothing agents for our throat. And drinking honey in children soothe a sore throat. Honey alone may be effective as a cough suppressant. Okay. So second one is expectorants, that is mucokinetic agents. These drugs are effective only in the treatment of productive cough. If there is a productive cough means sputum developing cough. If there is any sputum developing cough, we are giving with expectorant. So it expel the sputum. Okay, they increase the mucus secretion and expel the mucus through the sputum. And in that expectorants, it is divided into directly acting drugs and reflexly acting drugs. So directly acting drugs are classified as sodium citrate, potassium citrate, guaiacol and guaifenesin, Vasaka, balsam of Tolu. And reflexly acting drugs are sodium chloride, potassium iodide, which stimulate the receptors of gastric mucosa and reflexively intensify peristalsis of the smooth musculature of bronchi as well as a secretion from bronchial glands. These are the reflexly acting drugs. So, mucolytics are the third category of drugs in the cough production. They break down the network of fibers in the sputum responsible for easy expulsion of cough through sputum, that is bromhexine, ambroxol, N-acetylcysteine and carbocysteine. And fourth category of drug is antitussives, treatment of dry cough, that is non-productive cough. If there is no sputum or mucus, we can give with antitussive drug. They are classified as opioids, non-opioids, directly these are the drugs which are used in the antitussives. Okay, so these are the drugs which are used in the treatment of cough. And second disease condition is asthma. We all know that normal lung. In this picture we can see the muscle are relaxed, normal lining are there. So normal amount of mucus is produced. Where there is in asthmatic lung, the mucous membrane, the swollen lining is there. So excess mucus production is there and the swollen lining can be seen. That is the asthmatic lining condition. So the drugs which are used in asthma are, first one is bronchodilators. We have discussed in the first portion itself. It is classified into beta 2 agonists, that is short acting is there, long acting it is there. Okay, so long acting and short acting is there. Short acting beta 2 agonists are known as SABA, salbutamol, metoprolol, firbuterol, terbutaline, which is used in the drug of choice in emergency asthma condition. If there is an emergency condition of asthma, we can use with short acting beta 2 agonist like albuterol. Okay, so which provides immediate bronchodilation. In asthma condition, bronchus is constricted, so we need to dilate it. So in that condition, we can give with albuterol. Theophylline has been largely replaced with beta-2 agonist and is no longer recommended for acute bronchospasm. So the main area of beta-2 agonist short-acting drugs are palpitation, reflex tachycardia, muscle tremor and hypokalemia. And long-acting beta-2 agonists are salmeterol, formoterol, bambuterol, which is used in the treatment of corticosteroids. Okay, it is used in the long-term treatment along with corticosteroids. So if we are not using with corticosteroids, it will cause the cardiovascular death. So this is a frequently asking question. So it is not routinely recommended to discontinue a long-acting bronchodilator unless the patient experience an adverse effect or experience no therapeutic benefit. Okay, these are long-acting. And B category is methylxanthine, that is theophylline, caffeine, etophylline, aminophylline. C is anticholinergics, ipratropium bromide and thiotropium bromide, which is major ingredient in the inhaler. Okay, and second category of drugs inhibiting immunoglobulin reaction, that is IgE inhibiting, example like omalizumab, which is a monoclonal antibody, which is the drug of choice in moderate to severe asthma. And third category of drug is mast cell stabilizer, that is sodium chromoglycolate and nicodromil and ketodifine Okay, these are the mast cell stabilizers. We need to focus only in the drugs. So, fourth category of drugs inhibiting the leukotriene action are corticosteroids. You can see the example one by one. So, okay, betamethasone, mometasone, cyclizaron, prednisolone, budesonide, triamclone, hydrochlorothiazone, and fluticasone. Okay, so leukotriene synthesis inhibitors are xylazone, silutin, and which inhibit the lipoxygenase enzyme. And leukotriene receptor antagonists are montelukast and saferlukast, and magnesium sulfate can be used. So it is given by inhalation and IV route for the management of severe acute attack of asthma, drug of choice. So, okay. And last disease condition is chronic obstructive pulmonary disease. We can see only the drug. Okay, so drug of choice is tiotropium bromide, roflumilast, and theophylline. So this is a brief summary about the respiratory system which are used, drugs which are used. For acute asthma, we can use with salbutamol or albuterol we can use. In the chronic asthma condition, we can use with corticosteroid and anti-inflammatory drug, that is beclomethasone, prednisolone, and hydrocortisone. And if the moderate to severe asthma, we can give with omalizumab. And wheezing and chest tightness is feeling in the patient, we can give with corticosteroids. If the severe acute attack of asthma, we can give it magnesium sulfate. So these are the things which we need to study in the respiratory system. Okay, thank you.